Child Psychology Studies, Ainsworth. Mary Ainsworth used a structured observation with carefully planned controls and procedures to study caregiver-child interactions. She was looking at attachment types and maternal sensitivity and devised her own procedure to study such issues. She also looked at two cultures and later studies used her procedure in other cultures to examine differences in attachment types between cultures. The strange situation test. The parent and baby enter the room, which is in a laboratory, but set up with toys and chairs to be comfortable for participants. The parent does not interact with the baby, who is left to explore. The stranger goes into the room, talks to the parent, and then approaches the baby. At this stage, the parent quietly leaves the room. This is the first separation. The stranger tries to interact with the baby. The parent comes in and comforts the baby, then leaves again. This is the first reunion, followed by the second separation. The stranger leaves the infant alone. The stranger enters the room and begins to interact with the baby again. The parent is still out of the room. The second separation continues. The parent comes in and greets and picks up the baby, while the stranger leaves quietly. This is the second reunion. Attachment types. Securely attached. In this type, the child is distressed when the mother leaves the room and seeks comfort from the mother when she returns. This is separation anxiety and is expected when the child has formed a secure attachment with the mother. This type is linked to a responsive mother. In Ainsworth's study in Baltimore in the USA, about 70% of the infants were securely attached. Anxious avoidant. In this type, the child is not distressed when the mother leaves the room and tends to avoid her when she comes back. In Ainsworth's Baltimore study, around 15% of the sample of 26 families had babies who were anxious avoidant. Anxious resistant. In this type, the child stays close to the mother when the mother is in the room and becomes very distressed when she leaves. The child wants her for comfort when she comes back, but then rejects her for comforting. About 15% of babies in the Baltimore study belong to this type. Evaluation strengths. The procedure is replicable and carefully itemized so that the situation is exactly the same for all mother-child pairs, and observations can be compared. This gives reliability. The mother is in control with regard to the level of distress experienced by the child and can shorten the separation as much as she wants to, so ethical issues are covered at least to an extent. The great deal of evidence, including the work of Bowlby and Harlow, backs it up. The strange situation is laboratory-based and replicable, so it is reliable. Ainsworth also used naturalistic observations that were valid. Weaknesses. The procedure could be said to be culture-specific, as a situation with a child sitting in a sort of waiting room and playing with toys alongside the mother, and then the mother leaving, occurs in the USA and other Western countries, but perhaps less so in other sorts of culture. There could be ethical criticisms, as a child is deliberately made distressed. However, the mother knows exactly what the procedure is, so to an extent there is informed consent and the right to withdraw for the mother if not for the child. A fourth attachment type was later added, suggesting the theory was insufficient. The strange situation is laboratory-based and artificial, so it lacks validity. Attachment and responsiveness are hard to measure, so hard to study reliability.